is official. UnityPoint Health-St. Luke's has acquired MercyOne Siouxland Medical Center in Sioux City. The signage has already begun to change, and that acquisition was actually official September 1st. This announcement comes 3 months after a letter of intent was signed by the two Sioux City hospitals. This acquisition does not mean MercyOne Siouxland is closing. There are now 2 operating campuses. So here's what we know about the changes. MercyOne Siouxland is now UnityPoint Health-St. Luke's downtown. UnityPoint Health-St. Luke's will remain as is. The MercyOne Siouxland Medical Group, physician practices, and home care services have now transferred into that UnityPoint Health medical system. Now, UnityPoint officials say looking ahead, UnityPoint Health and MercyOne, those team members and providers will continue to deliver care and conduct business as usual with an ultimate goal of caring for the patient. With the announcement, both chief executive officers of UnityPoint Health and MercyOne did release statements today about this acquisition. Scott Kaiser, president and chief executive officer of UnityPoint Health, said in part, quote, "Patients can feel reassured that we will continue to provide the high quality care that they've come to know and expect from our organizations." Bob Ritz, the chief executive officer of MercyOne, released a statement as well saying, quote, "When we announced our intention to transition ownership to UnityPoint Health in May, we knew it was the best way to sustain and enhance nonprofit healthcare in Sioux City. I'm grateful for the hard work of the entire MercyOne team and our new colleagues at UnityPoint Health over the last several months that has brought us to this moment," end quote. Now, MercyOne Siouxland Medical Center has gone through major changes throughout the last few years. You know, back in January of this year, MercyOne announced the hospital was shifting from a level 2 trauma center to a level 3 trauma center. This changed some of its cardiac services and the dynamic there. Now, level 3 means hospitals still care for patients and stabilize them, but if needed, the patient would be transferred to a hospital with higher critical care management. Back in 2020, MercyOne discontinued its obstetrics, meaning it would no longer provide maternity care for the area. The hospital also told patients seeking a hospital for labor and delivery care that they should go to UnityPoint Health-St. Luke's. Taking a look back to 2019, the hospital took on a new logo and name. Mercy Medical Center became MercyOne Siouxland Medical Center. Now, earlier today, Jane Arnold, market president of UnityPoint Health Sioux City, joined me in Studio B to talk more about the acquisition. Jane Arnold, market president of UnityPoint Health Sioux City, is here to talk more about the acquisition. Thanks for being here.
Yeah, thank you for having me.
And we'll talk about patients here momentarily, but we want to talk more about the actual acquisition that happened Monday, September 1st. We know that was a holiday, but business as usual, like the acquisition. So why was the information released the next day? Today we're learning more about it.
Yeah, I think we made an announcement in late May, and there was a ton of excitement, and I can certainly appreciate that there wasn't a lot of information to be shared post announcement up till today. But what I can tell you is there's a lot of rules and regulations of healthcare, and there are a lot of people working behind the scenes to get us to where we are today.
Okay, so do you think that patients should have been notified the day of the actual transition?
Patients were notified appropriately. Our biggest thing was we wanted people to continue to seek care in the way that they had been seeking it. So the patient shouldn't have experienced any difference. Now that the acquisition is complete, we'll continue to take a look at services and look at services that have been discontinued or paused previously and align that with community need to build a plan for future healthcare delivery in Siouxland.
Maternity care and then the trauma 2 level, the services with cardiac. So do you think that will return?
Yeah, so we're taking a look at evaluating all of those needs. Certainly know that cardiovascular services and that comprehensive delivery of care has been changed at the MercyOne campus previously. We continue to offer comprehensive cardiology service at UnityPoint Health. So our teams will work together, and again, we'll look at the community need and align that to make a plan for the future.
All right, so layoffs, will they happen?
Yeah, so one of the biggest things that we're working on for right now is there's a national healthcare shortage. And unfortunately, Siouxland isn't exempt from that. And I think in 2026, they look at a shortage of 3.2 million in physicians, nurses, and healthcare professionals. So what we'll do, both campuses are using contract labor right now to supplement their staffing, and we're hoping that coming together, we can build a more robust permanent staffing base to better serve our needs and to continue to reduce that contract labor.
Okay, so do you think there will be layoffs?
We'll continue to look at back-end services for efficiencies and put a plan together.
Does this mean you could have hiring opportunities?
Yeah, definitely hiring opportunities, and just really super excited to combine the great things that people are doing at both campuses to build up our core services to enhance that delivery.
And a lot of unknowns right now, a lot of moving pieces. You're going to come back on and walk us through an update in a month?
Yeah, that will be great. I'd appreciate a further conversation with you.